IVF promises an immediate result. You start a cycle, you have a baby. But what we do know from population data really doesn't quite work like that. More than 70% of cycles fail. It's a very small percentage of people who actually go through one cycle and get a baby. The average number of cycles is 8 IVF cycles. An average cost for an IVF cycle being between $15,000 to $30,000, and you've got to do 8 of them. Okay, how can we demonstrate clinical effectiveness so that a new approach is seen seriously as a path for couples who may not conceive immediately, but can avoid and prevent the need for IVF? How can we help couples have healthier babies?
And we are live. Gabriella, how are you?
I'm good. Thanks for having me, Robert.
I'm excited to be chatting with you. So you are well-versed in all things fertility. I feel like I get a lot of questions, especially now with, HRT and people trying, and then just the general statistics are pretty bleak when it comes to the reproduction rate and fertility rate right now. I'd love to peel the curtain back on why you think all of that is, but I really kind of want to just know, to start, what got you interested in this in the first place? Like, was there a trauma that you suffered from, or did you just get inundated with this kind of requests and feedback? Like, what was the catalyst for you going down this path at the onset?
I think that one of the interesting things that I've heard over the years is Steve Jobs' explanation of the fact that you can't join the dots looking forward, right? You can only join the dots looking backwards. And for me, I never really planned to be where I am today, to be doing the things that I am doing. I guess, I was in high school figuring out what to do with my life and decided that health was something that I was interested in. And I started studying a naturopathic medicine degree, and that led me to be interested in women's health, which then led me to be interested in helping, prepare parents to be their healthiest possible selves in order to conceive. Interestingly enough, that went well for about 10 years. And I realized about that time that, I was getting referrals for people who basically were having difficulty. And one lady came into my office one day and said to me, I've been trying for 10 years and I've done multiple failed IVF cycles and I am about to give up. I'm going to do one last cycle. If I don't conceive, I'm just going to forget this whole having a baby thing. And I said in my mind, why are you coming to me?
Mm-hmm.
Clearly nothing else had worked. So I don't think that what I do is going to be relevant for you. And I actually did say that to her. And she turned around to me and she said, look, I'm going to give up anyway. So I just want to be healthier. So can you just help me do that? And I was like, okay. And that is literally what changed my entire career. That was the moment, because what ended up happening was that I treated this woman and she went on to conceive naturally with her own eggs after the age of 40, after multiple years of infertility, multiple cycles that didn't work. And that, I was kind of dubious. I was really I'm not sure if this was the thing. Maybe it was just luck, maybe that was just coincidence. And then a few months later, another lady came into my office having been trying for 19 years. And I'm like, seriously. But I was a little bit emboldened, at that moment, because I thought, well, if maybe this worked for somebody who was trying for 10 years, possibly it could work for someone who's been trying longer. Who knows? But also this lady was like 43 at the time. And, she had also had multiple failed IVF cycles. So I was very transparent, as I always am. That was one hallmark of Gabriella, Rosa, transparency, And so I was very transparent. I said to her, look, I don't usually treat this long-standing time to pregnancy situation, but I had a lady who I treated. This is what happened. We can see how we go. And she wasn't really that into it, to be honest. Like, her husband had brought her there and she was kind of like pushing back. And he was very determined that this was going to be something that they wanted to do because he wanted to have a baby. And she was like, fine, but this is my last try of anything. I was like, oh my God, do I want to get into this situation? Long story short, we did. We had a baby for this couple after, all of these ordeals. And at that point, I realized two really interesting things. Maybe this is a coincidence. Maybe it can't be just simple things that, executed in a specific way that really transform these results. But maybe there is something to this. And the second thing that I realized was that I actually much preferred talking to people who were done on their journey, who basically were like, you know what, I don't really care if this works or not. I just want to do everything that I can so that when I'm 90, sitting on my porch or my rocking chair, I'm not thinking, did I do everything that I could? And what if I had tried that one thing, like, you just knew that you'd done the things that were in front of you that you could have done, and that's that. So that for me was the part where I realized, okay, they are much more determined, much more committed, because they want to basically say to themselves, I have given it my all, and I realized that those were my people. Those were like my people that literally were like, okay, we're just going to do this thing. Let's go, And I transitioned at that point to only advertising and marketing my services and word of mouth to couples who had been infertile or experienced miscarriage or, other things that hadn't worked for more than 2 years. And that took me down a complete different path because all of a sudden I was attracting people who had had multiple failed IVF cycles, had done all of the treatments that their doctors told them, and really nothing had worked, and I started to see people who had, 20 failed IVF cycles, then conceived naturally. And I was very much focused on, okay, let's make sure that we have a checklist, to ensure that we leave nothing to chance and no stone unturned from a clinical perspective, that I was really, really focusing on not waking up at 2 a.m. going, oh my God, but did we test this thing for this person? So I started to really kind of consolidate my framework and became the Fertile method. Years later, fast forward to, just before I made another life-changing decision, I was having a meeting with an IVF doctor who essentially was interested in the types of results that we were seeing. Like, there were people that kind of were coming to me that were mutual patients that hadn't had success through IVF treatment, but then conceived naturally. And so somebody that we knew, mutual acquaintance, put us in touch and he wanted to have a meeting. I said, that's fine. So we sat together and had a meeting. He came to my office. And it was a really interesting conversation. And I think that probably one of the ones that really transformed the trajectory of my career. Because in that conversation, he was asking me, by this stage, I'm doing what I do now for 15 plus years. And he's asking me all of the types of patients that we're treating and the types of results that we're getting and how we treat people. And I'm answering very, very directly. And he turns around to me at some point in the conversation and says, you really shouldn't oversell this. Your results can't be that good. I was like, I beg your pardon? Interesting, you should say that because, this is why I want to do my PhD, to be able to really kind of validate what it is that we are doing, because I am seeing these results and I can't necessarily explain it either, but we have babies to prove it. Yeah. And immediately, the next sentence that comes out of his mouth is, oh, okay, I'll be your advisor. I'll supervise you. I'm like, yeah, sure you will not. So He left my clinic and I'm like immediately on the phone messaging one of my friends who was a professor of medicine at a university. And I said, okay, I need to do my PhD. Just help me decide on a PhD question. And she sends me papers and she sends me these things. And, all of a sudden I'm staring at this application for Harvard. And I go, yeah, that's it. I'm going to go to Harvard. That's what I'm going to do. And so, that's essentially how it kind of is still going. I'm on my last year of my doctorate now, 6 years in the making. But what was interesting is that halfway through, I completed the Master's in Public Health program, which really enabled me that my master's thesis was looking at our results. And that was what I was really interested in, like how do I actually understand and translate what we're seeing in the clinic to actual, real life results. And I was so interested in being able to understand who were the people that we were treating. And it turned out that, the thing that I thought might have been a fluke actually wasn't at all. We ended up with a 78.8% live birth rate on a cohort of 544 patients. The majority of people had experienced previously failed IVF cycles. 51.5% of people had experienced miscarriages before our treatment, and that rate dropped down to 13.5%. And the majority of people ended up conceiving naturally. So I was like, oh, okay, so this actually does work. It's not me just, thinking that it does. And that, got published as a poster in one of the major kind of fertility conferences. And so from that point, I was like, okay, this really does work. And not that I disbelieved it after, another 10 years of doing the work. It's now been, I've been doing this since 2001. So do the math, it's been a while. And now that I look at it, I go, okay, I can join those dots now and understand that what got me started certainly isn't what kept me going. Those interesting meetings along the way certainly helped to fuel a different questioning me, which is now I'm focused on, okay, since this is demonstrated to work, especially when, the average number of years of infertility in that cohort was 4 years. So imagine, on average, these people had been seeing negative pregnancy test after negative pregnancy test for 4 years. When in the general population, what we see is that it takes an average of 3 conception attempts, and within 12 months, 93.6% of people are pregnant. So they're outliers, in terms of what we see in the general population. But it's been interesting to see how it all kind of has fit in together and then where we are now.
It's got to be pretty fulfilling work too when you're dealing with people that are totally on the brink of despair and giving up entirely, and now you're blessing them with the ability to have a child of their own naturally. I mean, that's got to be like the most exciting thing for them and for you to be able to witness and play a part in.
Well, what's interesting? I think that this is part of what happens in life. When you're going through the challenge, all you can see and feel is the challenge. And so the journey itself for a lot of people is not the fun part. It's not the blessing part. It's not the part that we are thrilled by. And it's really only looking backwards that we see, okay, all of that hard work, all of that hardship, all of that those things that I had to do and give up and sacrifices I had to make. Yes, they paid off. But you see, if you can't hold on to that, the journey is miserable, which in turn makes what I do really, really hard. Because yes, when we get the babies, which we do for the majority of the patients that we see, it's wonderful. But actually, it's about the resilience that is required and the perseverance and the determination to actually do what it takes for as long as it takes, whether you feel like it or not, that gets results. When you have the right strategy. Because that's another thing that some people often miss is that they keep doing the same thing that hasn't worked, expecting a different result. No couple goes through 20 failed IVF cycles just hoping that the next one's going to be different somehow, even though I'm doing the very same thing. And, looks back and goes, oh, I want to do that again, right? It's like, usually it's like, okay, well, what do I need to do differently? But what happens, and I think that there's a lot of societal input in why people end up investing so much time, energy, focus, money, emotion into failing strategies, because it's the only option. It's sadly, in standard therapy, in medicine at this stage, in universal healthcare systems and privatized healthcare systems around the world, a couple is trying for more than 6 months. They will go to a GP and they will be told, well, here's a referral to IVF, right? They won't be counseled on, okay, here are all of the things that you need to make sure that you are optimizing in order to give yourself the best possible chance of conception. And then after you've really implemented those things consistently and you've given your body the time that it takes to see change, because as we know, biological systems, you might start something today. You're not going to see results tomorrow. You're not going to see results next week. You might start seeing results within a month. But really, if you think about it, every single red blood cell in the body is renewed when? At about 4 months. So every 4 months, you have the biological imperative that whatever's going on in your body is going to be hanging there for a while, right? And improvement is going to take time. And IVF promises an immediate result. You start a cycle, you have a baby. But what we do know from population data is that really doesn't quite work like that. More than 70% of cycles fail. And so, it's a very small percentage of people who actually go through one cycle and get a baby. The average number of cycles to have a cumulative, success rate of close to 80% is 8 IVF cycles. Imagine that. Like, imagine when we have, an average cost for an IVF cycle being in the United States between $15,000 to $30,000, and you've got to do 8 of them before you go, we're not trying out to see how your body responds. We're actually going for results now. Like, it's a little bit scary to me, but hey. And so my focus has changed, over the last kind of 20 plus years. It started with how can we help couples have healthier babies? I'm much more focused now, okay, how can we demonstrate clinical effectiveness so that a new approach is seen seriously as a path for couples who may not conceive immediately, but can avoid and prevent the need for IVF and or improve the chances of IVF working on a population level. That's why I decided to go and do public health at Harvard. It has been, by the time I graduate next year, fingers crossed.
You got it.
There is this tiny little clinical trial that I need to complete to be able to do that. But, if all things going well and all things being equal, 7 years in the making, and, we can start making some stronger waves around the world around this topic. Why not?
What are the actual stats on infertility rates now over the last 50 years, or just over a given period of time? Like, it seems as though I'm hearing of people dealing with miscarriages and infertility issues much more commonly now than ever in history. Is that just because of the publications of it, or is there like a legitimate massive uptrend in miscarriage and infertility?
Yeah, that's a very good question. And the truth is that even though 1 in 6 couples experiences fertility challenges, and fertility challenges can be inability to conceive, inability to keep a healthy pregnancy to term. So, what a lot of people don't understand is that miscarriages fall under the label of infertility. So, yes, it's prevalent. However, what we're seeing more than anything else is the fact that it has become a topic that is much less taboo than it was 20 or 30 years ago. And so we're hearing people talk more about it now than they ever have. Has it really increased? The objective number, no, it hasn't increased. Population fertility rates are declining, but that's not necessarily because of infertility rates increasing. There are other factors, at play. I mean, obviously, we're living really interesting times, to say the least, right? And a lot of people are actually questioning now, do I want to have children? I think that in our parents' and grandparents' generations, it wasn't something that people questioned. It was just something that you meet a boy, you meet a girl, you're going to get pregnant, you're going to get married. Hopefully, you're going to get married first. No sex before marriage, all those things. But hopefully that's what's going to happen, and then you're going to get pregnant and have a baby. Well, these days people are like, hey, do we really need to get married? Probably not. Do we really need to have a baby? No, let's just buy a house first. Let's set up our careers. So people are kind of delaying childbearing, and even the decision whether they will childbear or not, to a much later. I know a couple who I was talking to recently on a social level, and they are now in their mid-30s. They've been together for 20 years. And they're like, well, actually, no, we don't want to have children.
Mm-hmm.
I'm like, okay. So, times have certainly changed. So do we have an increased kind of rate of infertility comparatively? Not really in the last 20 years or so. However, we are seeing that there are parameters in terms of fertility that are declining. For example, sperm health has been shown to be halved in a 50-year period. So, those kinds of statistics, they're not made up. They're actually, facts that we are seeing happen. Is that something that is having an effect now in terms of people being able to conceive or not? Certainly for people who are struggling, yes, it is having an effect. And I think that this is something that we also need to really clarify and help people understand, is the fact that most people conceive without trying. So to this day, in the general population, this is why we hear so much of people who, that person had a drunken one-night stand and got pregnant accidentally. Or, oops, got pregnant, wasn't trying. Or, you name it. Or somebody who literally just got off the pill and decided to start trying and get pregnant. You see, that happens earlier in life, like when somebody's in their 20s, kind of up until their early 30s. Much more prevalent, much more likely for us to hear those types of comments, those types of conversations. And the reason for that is because that's just the natural way of things, right? Mm-hmm. So women and men are both more fertile earlier in our lifetimes than after. But there is also another consideration here, which is different people get affected by the same exposure in different ways, okay? So let me explain this. So let's say that, we all have heard of people who have never smoked a day in their life and died of lung cancer. And then we know people who have been chain smokers and never developed cancer at all. So why is that? Well, the reason is epigenetics. The same exposure affecting people differentially. So for some people, their weakness is their digestive system. For another, it's their nervous system. For another, it's their reproductive system. So not all people get affected by the same exposure in the same way. This is why when people say to me, well, but why is it that heroin addicts get pregnant so easily when I've got to do all of this work? I'm like, well, you're not them. So it doesn't matter. That's the first thing. The second thing is, what are you thinking? That you're going to go shoot up heroin and you're going to get pregnant easier? That's not going to happen, right? The reason is because either they're much younger, and we know that, in terms of addictions, obviously people who recreationally use substances or who are addicted to substances are usually younger. So that's one aspect. And the other is exactly what I just talked about before. They might have, mental health considerations to deal with as a result of their addiction, or even something that has led them to that. But fertility is not their problem. And so that's where we need to kind of understand that it really does not matter what is happening for another person in terms of the result and outcome that you want to create. If you are not having that result or that outcome and you want it, well, that means that you need to understand more about why is it for you that this is not happening, and what do you need to do about it? Because you can line up literally 10 men with sperm morphology or motility issues, or you name it, whatever parameter you pick. You can line up 10 different men and there will be 10 different reasons as to why they are having that particular outcome occur for them. And so understanding very specifically what's on an individual level happening for a person that's stopping them from getting the result that they want is the most reliable way to get results sooner. Because if you don't do that, guess what? You're just going to be trying blind, right? You're just going to be trying and hoping for a different result, having the same outcome, going, but I'm doing everything and nothing has worked. And it's like, well, actually, no, most people are not doing everything or not even close to doing everything. They're just doing all of the wrong things. Like, let me put it to you this way. Let's imagine that in order to optimize and improve sperm parameters, we have 1,000 things that we can do. But really, for the individual, there's only like 3 that will actually move the needle. But here they are doing the 800 things that is not really going to make that much of a difference for them, thinking that they're doing everything and nothing has worked. But they're doing everything that is not the 3 things that will move the needle in their situation. And so that's where the expertise to figure out and uncover, okay, why is this not working, is required. Because if you knew that, you would do it and you would get the outcome that you want. Most people stay stuck in a cycle of trying without success because they don't know what they don't know, unfortunately. That's one of the biggest reasons why people stay infertile. And for that reason, unfortunately, run out of time to have a baby entirely because they persist in that for too long.
And that issue is only amplified when they're going through the standard of care practice, which is being pushed to the IVF. And it's everybody's so individualized, but everybody's being pushed through the same pathway.
Exactly. And, it's kind of like, this is why people hear, oh, it's a numbers game. Yeah, it's a numbers game on a population level. You know what that means? It means that you get 1,000 people to go down the IVF path and you will get a percentage of those people who actually do get pregnant and have a baby. And you just keep telling people that. So you get more and more people and you get incrementally larger numbers of people who get pregnant, but not because of effectiveness, because more people are going through a treatment that is equally sub-effective. And so that's part of the biggest thing that I have an issue with is actually, I don't have a problem with IVF. I think it's a wonderful technology. I think that some people absolutely need it. And it was, of course, developed for people who have blocked fallopian tubes. The problem with it now is that you're getting every possible reason as to why somebody is infertile. Let's put, for example, endometriosis. People go into IVF because they have endometriosis. Now, here's the thing. The drugs that you have to use to stimulate an IVF cycle to get eggs actually exacerbates endometriosis. So it's like, well, how does that make sense? Right? Well, I mean, it might make sense in some very specific, like some people with endometriosis have blocked fallopian tubes, not all. So those are the types of nuances that you have to actually go, okay, does it make sense for this particular person? Because given all the pros and all the cons, which are usually greater if we're not addressing the underlying issues that are getting in the way, we end up with kind of like doing stuff, not for better results, but with a higher burden of emotion, cost, relationship issues that arise, a whole bunch of things that then have to be taken into consideration because we're not applying the right strategy for the right person in the right way, in the right order. And I think that that's what sometimes is really difficult for couples to disentangle for themselves because, most people aren't trained to be able to make these really important clinical decisions. They don't know even what questions to ask of their practitioners, of their clinicians, so that they can decide, okay, is this the best thing for me to do or is it not? What is the equipoise here? What is the level of certainty or uncertainty that I need to be comfortable with to be able to actually move forward with X treatment? Doesn't matter what it is, right? And therefore, because you don't want to be putting in effort into something that, like we know from guidelines, reproductive medicine bodies put out guidelines in terms of like, where is it absolutely futile to actually be doing an IVF cycle. And there are parameters on this, like with an AMH less than 1, with an FSH more than 10, with an antral follicle count more than 5. If I'm speaking gibberish here, don't worry. These are things that you can go, like actually a really good place to go and find out more about this is actually my Instagram account, because I do a lot of patient education on there. So people can go find it out. Gabriella Rosa Fertility is where they go. And I've put these guidelines up there, but those are the types of things that people don't understand to us. They don't know that if you have those parameters be met, IVF, it has a less than 1% chance of being successful. And so many, many people that come to me, they have all of those things, like literally they have elevated follicle stimulating hormone, they have lowered ovarian reserve, they have antral follicle count, which is a number of follicles developing in a cycle, be much lower than what it should be to indicate that an IVF cycle would have a good response. And yet they're told your best chance to conceive is IVF. It's like, hang on a second. Are you not reading your own medical journals? Because this makes no sense, right? And then that's where you have to query, okay, why is this happening? Are we dealing with misaligned interests? Tick, right? Because in the US, for example, most clinics are privatized. So what does that mean? The more cycles, the more dollars.
Mm-hmm.
In universal healthcare, yeah, exactly. In universal healthcare systems, it's a little bit reversed, like UK, Canada, Australia. It's a little bit reversed because the government is subsidizing heavily. And so what happens is the government goes, okay, this is the guideline. If you have these parameters, you are ineligible for an IVF cycle. You have to go pay for yourself, right? So most systems that are universal will give 2 cycles kind of on the house, so to speak. And if people don't conceive after that, they have to pay out of their own pocket, right? So the government is like, we're not going to invest, because we know if you're going to conceive, you're going to conceive within the first or second try. And if that doesn't happen, well, you're on your own. So then how does that change from the conversation that you will go and have with a doctor who runs a private clinic and basically says, oh, you have those parameters? Don't worry, we'll just keep trying. It's a numbers game.
Mm-hmm.
So, I have some challenges with that part.
Yeah, that's quite the hurdle for sure. With this being so individualized, have you noticed any common denominators, like when people are coming to you because they're all coming in a similar demographic, having been trying for quite some time unsuccessfully? Do you notice common denominators amongst that cohort? Like, do you see just some general commonalities?
Absolutely. I mean, look, there is no way to get around this very important fact. A healthy body is a fertile body.
Mm-hmm.
I think that so much of the glean, the desire for technology comes from the fact that, surely it must be better. Well, actually, no. It isn't. What is better is your body being at optimal health or as close to it as possible. I often talk about the fact that, let's say that, on the top of my head, so if you can't see me, you can only hear me. Let's just say that I'm pointing to kind of like above my head, right? And let's imagine that is optimal fertility. Okay. Now, let's say that you're starting out somewhere around my chest. And all of a sudden, you understand that, okay, that's not working. The level of health that I have here is not actually leading me to be able to have the outcome that I want, which is my healthy baby. So you then start to look at, okay, how can I improve my health? How can I edge this up in such a way that is closer to? Do I have to get to optimum fertility to be able to have a baby? Not always. Not always, but you certainly have to get away from where you are. You see? And so that improvement of how do we optimize health, biological and biochemical function, is automatically going to improve the chances of a healthy pregnancy and baby. I was doing a literature review recently about the effects of smoking cigarettes on the ability to conceive. Literally, you want to slash the chances of having a healthy baby, especially when things have not been straightforward, is you don't have to have both partners smoking. You can just have one. Mm-hmm. And all of a sudden, your chances of getting pregnant and keeping a healthy pregnancy to term, whether it is the man that smokes or whether it is the woman that smokes, halves or more. in terms of worsened outcomes. So when you are trying to get pregnant, most people will ask me, what are the things that I need to do in order to improve my fertility? It's really very simple, actually. If you think about it from this perspective and ask yourself, and Robert, let's try this with you, right?
Okay, I'm game.
Okay, all right. So if I was to say to you, you're going to have to indulge me for a little moment here, right? Just imagine for a moment that you could be pregnant. Okay, don't worry about how the baby's going to come out.
Could be.
Don't worry about how the baby's going to come out. We can deal with those problems later. But let's imagine that you are pregnant right now.
Okay.
Can you do that?
I've got it.
Can you imagine the baby developing and growing and kind of like your belly expanding and, this whole 9 month. We often see these videos on social media where, men have the watermelon wrapped up to their bellies and they can't tie their shoelaces and all of that stuff. Beyond that, imagine the care that you have for that little being that is developing inside you because of you, right? Now, let me ask you this question. If you were pregnant right now, what are all the things that you absolutely would start doing or stop doing to make sure that your baby is as healthy as possible in that developmental process? Now, I don't want to put you on the spot. So what I'm going to do is I'm going to say, you're going to give this advice to your friend who's pregnant right now. And he needs to be counseled on the things that he needs to start doing or stop doing. What are some things? Let's just list top 5 that come to mind.
Yeah, I mean, all the basic high-level stuff, get sleep, eat good food, move your body, exercise, train, stay hydrated. I mean, like all the fundamentals that we all inherently know to be true, yet so many people totally miss the boat on. And I feel like if you are carrying a baby, not giving that the attention it's due is the most selfish thing I can imagine. Like it just breaks my heart. Like it doesn't make sense to me.
Now, let me ask you this question. Would you recommend that this friend smokes cigarettes?
No, definitely not.
Would you recommend they drink alcohol?
Definitely not.
A little bit?
No, rock and roll as clean as you can be. You can do anything for 9 months.
What about some pot from
Probably
time
not.
to time? So can you see how simple this stuff really is? When we come down to it, it's really not like you can clean up the majority of someone's biochemistry by really focusing on those very important foundations, right? And yes, they are foundations, but they are kind of like my minimum expectation. So ultimately, yes, there will be parts of this equation. And for us in the clinic, really, we're looking very deeply into precision diagnostics and how do we actually make recommendations that are going to be precise and specific to what that person's genetic factors are and, you name it, lots of different things. But on high level, it's really about acting pregnant now to get pregnant later. That's what I recommend all people who are. And I say all people because this applies, fertility is a team sport. There is absolutely no world in which a woman or an egg can do the work of both partners. There just isn't.
I want to dive into that a little bit more because I feel like a lot of guys are totally ignorant to that fact, and they just assume that, hey, they do their one role and that's all she wrote. But from a genetic standpoint, from an epigenetic standpoint, from gearing that baby for the best chance of thriving as you possibly can, like it really does take 2 to tango. And there's a lot more that goes into the health of that sperm than just simply releasing that sperm into the woman. So
100%.
Yeah, I mean, it's like a straight up 50-50 as far as like the health of the man and the health of the woman, right?
100%. And you see, here's the thing that happens. A lot of people don't realize that recurrent miscarriages happen 50% because of sperm parameters and sperm factors. You see, DNA fragmentation heavily increases the risk. And, poor sperm motility, morphology count, all of those factors will lead to increased risk of IVF cycles failing and miscarriages occurring, implantation failure happening, fertilization failure happening. So at all those points, you can pay $30,000 to go and do an IVF cycle and still end up with absolutely zero other than the trauma of the experience, because you haven't optimized those cells prior to actually having a baby. There's this huge misconception that is rampant on the internet, which is fertility begins with the egg. It's not true. It's not true. The egg is a biological milestone that has been an outcome of many biochemical chain reactions that has started way before. In fact, it's generational. So we here, listening to this, talking to me, etc., we have all been in our grandmother's wombs. Imagine that. You know, our mother, we women are born with all the eggs we'll ever have. We were the eggs inside our fetuses, as they were our mothers, the fetus that was inside our grandmothers. Our grandmother's exposures affected the development of the baby that was inside her and her future generations.
It's pretty much 3 generations deep for most.
It's more, really. You know, it's more, but at the very least 3. Because what happens is, and of course there are inputs and there are things that you can do to optimize chances of conception now, irrespective of, you know, what has happened in the past. Look at me, for example. You know, my mom, she was a smoker when she was, you know, basically, she didn't even know that she was pregnant with me. She was on the pill. It was the 70s. You know, so basically she conceived without trying, clearly being on contraception, not wanting to be pregnant, right? And whoops, she was 21. She was married for 3 years, but she didn't want to have a baby. She was focusing on her career. I decided that I had other plans. But I was going to do whatever it is that I was going to do. Nothing's changed since then. But, you know, the reality of it is that if you look at it from that perspective, you could say that, oh, because you have those exposures, then it's going to affect you for life. In some ways, you know, I was then diagnosed with polycystic ovarian syndrome, but I was able, through the things that I was implementing and, of course, teaching my patients and doing myself, I was able to conceive naturally and deliver 2 healthy babies, you know, despite all of these challenges. And so the reality is that there is a lot that can be done. If it's not happening, that's where you need to go, all right, I need to up the ante here, because the status quo of where I am right now is not doing the job that is required. Is it possible to change? In many situations, yes. In many situations. But it's certainly not going to do itself if it hasn't been easy. And I think that that's the biggest takeaway that people need. It's like, stop comparing yourself to somebody like my mom who conceived without trying, right? And start understanding that you are a different individual with a different biological system that has different requirements, and that you do need to do different things. Full stop.
For people that are like trying to get pregnant, struggling, taking an individualized approach and doing what needs to be done is obviously the most sensible thing to do. How do you get people to be even more proactive in the sense of, hey, let me live my life now in a way that sets my kids and their kids up for success? Like, how do you make that mental shift occur in people? Because I don't think people realize how important their daily decisions truly are.
No, I don't think they do until they have a desire to understand it. You see, and I think that really is, it's like, you really can't make people do anything. They have to be willing. They have to have a desire strong enough to actually want to understand. And I feel like you've mentioned before, you know, there are some people, some men in particular, who don't want to understand. They don't want to be bothered with stop drinking, smoking, doing drugs, you know, partying with their friends and whatever else. But then that's the point where you have to ask the question, how much do you truly want a baby? Because if you're saying with your words that you want a baby, but your actions are demonstrating all of the things that tell me that you don't actually, because you're not doing what is required to get that outcome, stop lying to yourself and stop lying to your partner, because fertility is finite. especially for women, you are not going to have the opportunity to continue having, the chance of having a baby for the rest of your life. And, the patients that I see this sometimes, and I feel really frustrated, actually, when I get a couple and this dude is just like going, oh, yeah, I don't really need to do this. Why do you need to do this? My first question is, how much do you really want to have a baby? Are you just like, pretending to this woman that that's something that you want? Because like, if that's the case, stop, because that's not going to actually get you, either of you, anywhere, you see? And so that's the thing that I think sometimes people actually have the biggest difficulty of being honest with themselves and with their partner about what it is that they really want or what it is that they really don't want. You see? And I think those very frank conversations are so necessary, are so needed, because there's a difference between somebody who, for example, might be addicted to nicotine, right? And goes, all right, I now understand that I need to quit smoking because this is doing these things to my health, my fertility, and it's not going to improve my chances. But I'm struggling. I need help. I need medications, counseling, hypnosis, like whatever the hell, right? Like you just go, there is help out there.
I've actually got a question on nicotine for you. I don't want to derail you, but on that topic, so nicotine has been used a lot lately in studies around nootropics, Alzheimer's, dementia, things of that nature. Is nicotine in isolation detrimental to fertility, or is it just using the delivery vehicle of tobacco and smoking that's detrimental?
It's all of the above. So nicotine, which leads to cotinine, is all going to be negatively impacting of fertility. So the metabolite of nicotine actually is demonstrated to increase the risk of implantation failure, miscarriage for either partner. In fact, there is a study that I've sort of seen recently that shows 1 to 4 years of for women who are exposed to nicotine, and often it's by cigarette smoke, but also e-cigarettes and, even secondhand smoking and third-hand smoking also has a similar effect. So it's not just whether one person smokes, it's whether they are exposed to even people at work smoking. Like if you look at building sites and lots of people smoke around you, well, if you're exposed to that, it's probably going to have an effect. So, and yes, it is nicotine and all of the other chemicals. I mean, there are many different types of chemicals in whatever delivery mechanism you're going to use. Even in vaping, there are other chemicals. And so we have to be very cautious. There's a lot of research on nicotine, though. We have to be very cautious about all of the other chemical exposures that are going to be coming in from the delivery systems of that as well.
Gotcha. I didn't mean to derail you there, but you just said nicotine and it parked my interest there.
Yeah, no, that's for sure. But so going back to the conversation of, how people actually make these decisions and whether people are actually on the same page, I think that this is such an important thing for both partners to really, one, ask themselves and really have the conversation with their partners, because otherwise what ends up happening is that here we are, one person really keen, really wanting to have a baby, really doing all of the things, and the other person kind of really letting the team down, And this can happen on both sides of the equation. This is not just something that men do. It's something that some women do too, right? And sometimes it's that inability to be honest with oneself and to really face the fact that, okay, well, either I don't want to have a baby, or I don't want to have a baby with this person, or I don't want to have a baby now, or, many permutations of that conversation. But the ultimate outcome is, this is not going to happen at this stage, in this way, with this person. And if this other person wants that in their life right now, well, you've got to let them go and do whatever it is that they're going to need to do that. Because otherwise, the relationship is doomed for failure regardless, right? So either we find a way to get on the same page, or we get off the same book and go find different books, to write. I think that that's a really important thing that many people don't talk about.
Totally agree. When it comes to things that are obviously and blatantly harmful, smoking, drinking, drugs. There's not really any argument in favor of those, especially if fertility is the goal. When it comes to things that are compounded daily that people often take for granted, such as the foods they consume, the quality of the nutrition they're taking in, like people can turn their nose up to drinking because that's obviously bad. There's not a good argument for it. But with food, it's in this weird societal, emotional realm because you got to eat to live. And there's all this dogma around what food is optimal. Mm-hmm. So when you're working with people and you're suggesting they clean up their diet, what kind of parameters do you find the most success in pointing them towards?
I mean, look, as you're asking this question, I laugh because, as you're asking, I'm like going, because it is such a huge issue in our society from a food environment perspective. And look, I'm saying this coming from having a nutrition epidemiology concentration from Harvard. Right. So like nutrition epidemiology is one of those things that essentially it's the study of exposures on a population level. And so in this case, it's the study of food and nutrients and or lack thereof over time on a population level. And so what does this mean? Food is one of those really important exposures that will lead to health or disease. It's not a matter of whether it will. It will lead to one of those two things. So depending on your choices over time, and this is the problem that a lot of people have, is that because we can't see the negative impact of trans fats that was consumed from these baked goods that we bought, or whatever. Like, I won't name names. I don't want to be sued today. But let's say you buy this packet of something with a barcode in a supermarket and you start eating that, and you might eat that 3-4 times a week. And, over time, you might eat it more or less. Make no mistake, you can't see the impact of that activity, behavior, exposure, whatever you want to call it, today, maybe not in the next year, maybe not in the next 20 years, maybe not in the next 20 months, but you will see it in the next 20 years. You will see it in the long term. Now, just because you can't see the immediate and direct effect doesn't mean that it's not happening, because a lot of times what happens before we see pathology is that we see derailment of biochemistry. Okay, so for example, insulin resistance is a classic case. Most cases of insulin resistance are undiagnosed. Most cases of pre-diabetes are undiagnosed until it has become overt enough to be diagnosed as diabetes. But we know from population studies that the second that you have been diagnosed with insulin resistance, it's not a matter of if you will develop diabetes. It's a matter of how long it will take. Mm-hmm. Population studies show that it's approximately 10 years from being diagnosed with insulin resistance to being diagnosed with diabetes. Now, is that an irreversible diagnosis? No, it's not. At the point of insulin resistance, there's a lot that can be done. From choosing different foods to the type of exercise that you do to you name it. There's lots of different things that can be done to reverse insulin resistance, to reverse prediabetes. It takes work. It takes a whole lot of work, but it's possible. And it's most effective with lifestyle changes. Mm-hmm. The types of exercise you do, the types of food you eat, et cetera, et cetera. So the key thing here is to understand that when it comes to fertility, it's even more important because not only we're talking about the metabolic and biochemical effects of food, but we're then also talking about the chemical effects of food. And those chemical effects, they will be coming from various things. They will be coming from the nutrients that the food actually has, but they will also be coming from the additives, flavorings, preservatives, colorings that have been added to the food, in addition to the packaging of said food. So how many people go, oh, I need to buy BPA-free water bottles because, BPA is bad for your fertility. Well, did you know that Tetra Paks that hold those kind of funky milks that you buy in the supermarket and, different types of cans, in fact, all cans, canned foods and so on, they're all aligned with a plastic that has BPA or bisphenols in them.
Mm-hmm.
So you might be doing all of this thing about, I'm buying, water in glass. Well, good for you. And you're eating some kind of pre-prepared packaged thing that comes in plastic or comes in some kind of, crazy Tetra Paks and cans. You're not really making a difference there. So when you say, okay, how do we eat to optimize fertility? I have a very simple guideline that I give to my patients, which is field to plate. If you can recognize the food on the field, obviously we're talking about vegetables and fruits and, nuts, seeds, etc. If you can recognize it, then you know that you're one step from field to plate. Great choice. Let's say corn. Let's use corn as an example because corn is an easy one for us to picture. You can see corn cob on your plate. You can literally picture that in the field, right? Now, let's say the second step from field to plate is that you've taken that corn cob and you've removed the kernels. So you've got the kernels on your plate. You can still recognize it. You can still know that it's corn, but it's processed in a way, right? Now, let's say you actually go and make your own homemade cream corn, right? Now you've got the kernels, you've added some additional ingredients. You can still somewhat recognize it, but you've got some other things in that. That's 3 steps from field to plate. That's where I recommend people stop.
Mm-hmm.
Okay? Because at that point, you're starting to have food denatured to a point that you can no longer recognize it. And that will start to impact the way in which that food plays a role within your body. Let's give corn again for that example. Now, we know that there's only so much corn on a cob that you can eat, right? You might be able to eat 1, maybe 1.5, maybe 2, but most people are not going to go eat 5. Right? It's like, it's hard to eat. It's hard to chew. You've got the things in your teeth. It's a bit annoying. If you take those kernels off, it's very easy to eat 3 corns, the equivalent of 3 corns or more. If you then go and process that and you make it into cream corn where you blend it and you put other things, you're definitely going to eat more. And so then your glycemic impact is going to increase, because you're having a higher carbohydrate load, you're having a higher glycemic impact of that food in your body by the processing alone.
Mm-hmm.
Okay? So then let's take that onto another step, which is basically we now have made we've pureed the whole corn and we're making, some corn preparation, tortillas. Or we're making, we're drying that up and we're making it into something else like polenta, right? And then you're reusing or using that to make something else, another dish. You can no longer recognize those foods. So those foods are what I call 10% for the soul. So if in 21 meals in the week, you have 2 meals, that essentially is whatever you want. That's where I highly recommend pizza, okay? So then it's fine, but you know that there is a literal hard stop in terms of what it is that you're doing. It's not 2 meals a day, it's 2 meals in the week, right? And let's say that, of course, if you know that you're sensitive to gluten and dairy, pizza is not going to be for you, okay? Because those sensitivities that happen on a threshold, if they are getting to the point where they're giving symptoms, they are affecting your fertility, whether you can link it or not. Just take my word for it. I do this all day long.
So a pretty good argument made towards high quality, natural, wholesome, single ingredient, quality fats and proteins without excessive carbohydrates.
Absolutely. And you know what? That is the best way to eat to be the healthiest that you will be for long term, for your whole life, not just for your fertility. And foods with additives and flavorings and colorings and everything else, can they still be a part of a fertility diet? Probably less than 10% for the soul. I would say that maybe once a month, maybe twice a month. But I wouldn't be going much beyond that, because from that place, you will have detrimental health effects, whether we're talking about fertility or otherwise. It's not a matter of if, it's a matter of when.
Mm-hmm. I'm curious. So I'm assuming you probably get a relatively large demographic of patients that are coming in that have, pre-diabetes, insulin resistance, diabetic, maybe some obesity. Do you also see quite a few that are struggling with infertility because they are chronically under-eating and stressed, and their body is just in this, sympathetic state more often than not, where they are not a viable, carrier of creating a new life to begin with?
Look, I think it really depends on the individual. It's those things that we've talked about. The fact that it's every effect is going to depend on many other factors of what's going on within that person's body at a time in their life as well. You see, so I don't typically see, just the way that population health is going, I don't typically see people who are they are undernourished. Most people are undernourished, right? They're not having the nutrients they need, but they're overfed. Mm-hmm. And so most people are overweight. They're dealing with metabolic health conditions as a result of that. And so ultimately, yes, we do get some people with food, bulimia, anorexia, those kinds of challenges. But it's not common to the couples that I see typically. Most of the people who I see, they're having metabolic disease happening the opposite side of that equation.
Gotcha. Makes total sense. Talk to me about this this study that you're gearing up for. I want to talk about the trial that you're working on. Anything that we can do to help aid in that?
Absolutely. So we're looking for females who feel like they have experienced infertility-related trauma or grief that is not fading. They've gone through, whether it's inability to conceive, inability to keep a healthy pregnancy to term. And I'm running a intervention that is designed it's very simple, very gentle. It's 20 minutes a day for 4 days. So people can do this anywhere in the world from the comfort of their own home. They just need to be able to type and need to be able to have access to a computer and, of course, speak English and be able to write in English. But, and they can write badly. So, this is all about writing badly. I tell all the participants of the studies, okay, today we're going to write, but we're going to write badly. And so it's about a brain dump on the screen, so to speak. And what this research essentially is looking at, there's been a lot of other studies that have been done on this very topic in different health conditions, in chronic health conditions, and it has demonstrated to be very effective for other populations. So what I'm trying to say is, because infertility and miscarriage failed treatments is such a huge ordeal for so many people, and it does leave people feeling extremely burdened financially, emotionally, physically by the process itself. I want to see, is there something that is going to be really helpful for people that's easy to use and simple to implement, that can be done anywhere around the world at any point on a fertility journey, that's going to help to alleviate those feelings of challenge, throughout the journey. And so that's what this study is all about. So people can go to Inspire Study, so it's inspirestudy.online, and see if they're eligible. It's my doctoral thesis, so they're going to be helping me graduate finally.
Yeah, you got to get this to get your PhD. So you got to have that.
I do. That's why, come on, people, let's get this done.
Well, out of curiosity, what is the standard of care for those people currently? What are they? How are they directed if they're struggling with grief due to an infertility?
Sorry, what?
Nothing, but basically, right?
What do you mean? I'm confused. Unfortunately, look, some counseling is offered, but most people refuse it because talking about their challenges is hard. And actually, there is evidence that shows that talk therapy is not as effective as this intervention that we're running. And so that's why I want to see, okay, let's look at, for people who are actually struggling with infertility, because this study has been done in a similar way for people going through an IVF cycle, and they've seen positive results in quality, feeling decreased levels of stress in the population that was studied. I'm looking more for around that, how does this actually affect more on a long-term level for people who have been trying for a whole lot longer. And so that's the distinction, and that's where there isn't any evidence around this. But if we can demonstrate that it does improve quality of life, reduces stress, it definitely is something that can open up a huge avenue for people to get better care in a really simple, easy way around the world.
And stress, people take for granted how much of an impact stress has on basic physiological function. Like if they're still in a stress state from a prior failed pregnancy, their likelihood of conceiving and carrying to term, I would imagine, I don't know how you would quantify that, but I would assume is significantly reduced.
Yes, there is some evidence that shows that stress can impact the chances of conceiving and keeping a healthy pregnancy to term. And of course, certainly severe trauma that is recent and or long term will have an effect there. I don't like to put that into people's heads, though, from the perspective that we all know people in war zones get pregnant and have babies, right? So it can't just be stress, but the differential effect definitely exists. So someone who, for example, has a history of trauma and mental health conditions or, just different challenges in their life, of course their body is going to be more affected and more sensitive to emotional, kind of trauma than other people might be, right? And so those are the different types of things that obviously we need to disentangle and we still need to get more clarity on. There isn't, to my knowledge, on a population level, really any study that shows, and I'm just trying to think, but to my knowledge, I haven't seen any studies that show a direct cause and effect relationship between stress and infertility or stress and miscarriage. There's a lot of really interesting work that's being done in different universities around the world. In fact, Boston University has a wonderful researcher. He's written a book called The Body Keeps the Score. And it's a wonderful kind of research framed and focused work talking about the effect and the impact of emotions on our health in general. And there's a lot there, psychosomatic disease, etc. These things, obviously, there are links and we can certainly make some extrapolations, but I haven't seen any direct cause and effect, work on this topic before.
Well, it seems as though you're definitely tip of the spear leading a lot of this research to figure out how this is correlated and set people up for success long term. So I can't thank you enough for fighting the fight.
Yeah, we definitely want to do that. That's for sure.
Absolutely. One more time, what is the link where people can go to dive deeper into your world and get involved in that study?
Yeah, they can go to inspirestudy.online.
Awesome. And where are you at on social again, so people can find you there?
I'm at Gabriella Rosa, so it's Gabriela, so 1L, ROSA Fertility. And my website is fertilitybreakthrough.com, but people can Google me, Gabriella Rosa, they will find me in all the places.
Well, I will certainly link out, make it easy for people to find you as well. But keep doing what you're doing. You're making an impact for sure. And I just applaud your work. So if there's everything I can do to help move the needle forward, you just let me know.
Thank you so much, Robert. Really appreciate it.
Appreciate you. Take care.